Well, you know, the song says that it's the most wonderful time of the year, but it can also be the most depressing. Many people struggle mentally during the holiday season, and we've reported in the past about some suicides that actually happen leading up to the holiday season. One of them, the celebrity DJ Twitch, which we've heard a lot about. But we have asked Emily Reedford, the mental health advocate with Easter Seals, to join us today to talk more about this whole issue. Emily, thanks so much for joining us. Why is it that the holiday period can be so hard for many people?
Well, the holidays can be hard for people for a lot of different reasons. First of all, we're dealing with less sunlight, and we know the chemical imbalances that can pose in people. But also there's an increased stress around the holidays, too. A pressure to make everything perfect. A lot going on with obligations and year-end commitments and that kind of thing. And a lot of financial stress as well. Such high expectations, too. It's hard to live up to that. Now, you know, I just mentioned Twitch. All over social media and in the news, we've heard a lot about that celebrity DJ Twitch who recently died. His family has come out to say that it was suicide. Often, that's not even talked about. And while that's understandable, it's difficult for the family, that's a problem that we don't talk about it, right? Yeah, it can be difficult for people to talk about, especially if they've had a loved one pass. But in fact, that's what you should do. By sharing those stories and sharing where to get help and that help is available, that actually can help save somebody else's life.
So let's do that. You know, I've read that suicide is preventable, but I've been at visitations where family and friends say they had no idea that the person that died was suicidal. What can you say to that? Are we not seeing the symptoms?
It's hard to say. What I do know, having done this for many, many years, is that human beings are incredibly good at showing what they want to who they want. And what I mean by that is people are very good at putting on that social mask, right? Putting on that brave face, putting on that happy face, where something can appear like it's just everyday life for them and that they're happy and that they have things all together, when inside and internally, people are really struggling. So we have to be cognizant that, of course, we're reaching out to those who are outwardly depressed and showing signs of sadness and that kind of thing. But we also have to reach out to those who we may who we may not expect are dealing with suicidal thoughts, because the truth is that anybody can be suffering at any time.
So how do we do that? What do we look out for?
I think some of the things that I always look out for are a big change in mood. Whether it's sadness to happiness or happiness to sadness, that kind of thing. I think it's always just a good idea in general to check in on those who are feeling happy and feel like they have everything together also. And that can look like just a conversation about, wow, you know, you seem like everything's okay, but I'm just, you know, wondering how you are. And you seem to be handling the stress so well, wondering your secret, or you know, if there's more to it than that. Are things really as happy as they seem?
So, you know, depression is one thing and feeling down, but how do we know when someone is in real crisis? What signs are there for that?
Yeah, if someone's in real crisis, you're going to see that pretty apparently. They may start using substances like alcohol or other drugs, experimenting with those. They may be unable to sleep. They may just seem agitated and with a short fuse, like anything kind of sets them off. Temperament-wise, they may completely just kind of change their habits. Maybe they're unreliable. They seem moody. Or helpless or hopeless.
Now, these are things we need to look out for, and I know there is the 988 number to call, but locally, do we have agencies here? Who do we turn to help?
We do. So locally, you can call Southwestern Behavioral's crisis line, and that number is 812-422-1100. And that's actually answered here locally. And what's great about that is they have a unit open to where if someone is in acute crisis and they don't quite need the hospital, they can go to that crisis unit and spend up to 24 hours there and just kind of get calm again, kind of get some things figured out. and get away from that crisis situation if they need to.
Okay, Emily, this is great information any time of the year, but especially right now. We're going to try to get that number up on our website so they know. But in the meantime, easy to remember, 988 for anyone in despair or having suicidal thoughts. Please call that number. It is manned 24 hours a day. It's the crisis line. Emily Reedford with Easter Seals, thanks so much for joining us.
Thank you.
Have a good Christmas.